Hello, my name is Patches Pitts. I'm going to be talking about breast cancer prevention. Breast cancer is one of the most common forms of cancer found in females. Screenings and prevention are scenarios that are imperative for the reduction of morbidity and mortality rates of the disease. The health promotion interventions are aimed at educating people on the risk factors, such as healthy lifestyles and engaging in healthy practices that include screening cancer in its initial stages. The treatment outcomes in cases where breast cancer is diagnosed early are more therapeutic and the survival rates will be higher. Community education and public health campaigns have increased awareness among individuals about breast health practices and the importance of screenings. The role of the healthcare professional also plays a vital role in educating patients about preventative strategies such as adopting a healthy lifestyle and participating in regular screening programs. Overall, the health promotion incentives that focus on breast cancer prevention empower individuals and communities to take proactive steps, which can lead to improved long-term health outcomes. Breast cancer is the most commonly diagnosed cancer among women worldwide and remains a major cause of cancer-related deaths. In the United States alone, more than 270,000 women are diagnosed with breast cancer every year. This disease not only leads to mortality, but also significantly affects a person's quality of life as well as their emotional and financial well-being. The economic burden associated by the diagnosis, the treatment, the tests, and the long-term care places a significant strain on both individuals and the healthcare system. Furthermore, breast cancer outcomes vary across different populations. Women in underserved communities are more likely to be diagnosed at later stages, have limited access to healthcare services, and experience poor outcomes. These disparities highlight the importance of equitable screening and preventative programs. Addressing these gaps through increased education, improved access to screening services, and community outreach initiatives can help reduce the overall burden of breast cancer. Breast cancer develops when genetic mutations occur in normal breast cells, disrupting the normal growth and division processes. As a result of these mutations, cells begin to grow and divide uncontrollably, leading to the formation of tumors. Most breast cancers originate in milk ducts or lobules, which are responsible for milk production. Abnormal cells in these areas continue to multiply uncontrollably, eventually invading surrounding tissues and potentially spreading to other parts of the body. This process is known as metastasis and typically occurs through the lymphatic system or the bloodstream. Certain genetic factors, such as a mutation of the BRCA gene, can increase an individual's risk for developing breast cancer. In addition, hormonal influences, environmental exposure, and lifestyle factors may contribute to abnormal cellular changes. Understanding the pathophysiology of breast cancer can help healthcare providers identify risk factors, improve diagnostic methods, and develop prevention strategies aimed at detecting early cellular changes before the progression of invasive cancer. The Healthy People 2030 initiative outlines national objectives aimed at improving population health outcomes, including reducing breast cancer mortality and increasing participation in breast cancer screening programs. Among the key strategies is enhancing the accessibility of the preventative services to enable more women to get regular mammograms and early detection services. The U.S. Preventative Service Task Force has evidence-based screening recommendations that are aimed at detecting breast cancer at its early stages. These recommendations emphasize regular mammography screening for women within the recommended age groups to help reduce breast cancer mortality rates. The objectives also are aimed at eradicating medical inequality by providing preventative services to underserved groups. It is advised that healthcare providers inform patients and give information on risk factors and the advantages of screenings. By following these national objectives and guidelines, healthcare professionals can enhance early detection rates, reduce breast cancer-related deaths, and improve overall health outcomes for individuals at risk. The symptoms of breast cancer vary widely, depending on the stage and location of the tumor. One of the most common early signs is a painless lump or mass in the breast tissue. However, not all lumps are cancerous, which highlights the importance of medical evaluation. Additional symptoms may include changes in breast size or shape, skin dimpling that resembles an orange peel, an abnormal nipple discharge unrelated to breastfeeding. Some individuals may also experience redness, swelling, or persistent breast pain. It is important to note that breast cancer may sometimes present without any noticeable symptoms, especially in its early stages, which underscores the need for regular screenings. Healthcare professionals assess patients' history, perform clinical breast examinations, and recommend diagnostic tests when suspicious signs are present. There is a number of risk factors that cause breast cancer. One of the most relevant risk factors is age, because the risk of breast cancer increases with age. Family history is also an important factor, particularly when close relatives such as mothers or sisters have been diagnosed with the disease. Genetic mutations, BRCA1 and BRCA2 genes, play a significant role in increasing an individual's lifetime risk of developing breast cancer. Hormonal factors also contribute to the risk. For example, an early onset of menstruation or a late onset of menopause increases exposure to hormones associated with breast cancer development. Lifestyle factors further influence the risk, with obesity, alcohol consumption, and physical inactivity are all linked to a higher likelihood of developing the disease. Awareness of these genetic, hormonal, and lifestyle factors help healthcare providers identify who may benefit from early or more frequent screenings and preventative interventions. Screening is an important component of identifying breast cancer at the stage before any symptoms develop. The most popular screening procedure is a mammography, and it is the primary diagnostic measure used to detect following early abnormalities of the breast. This type of imaging method has the ability to identify tumors that are too small to be detected during a physical examination. Additional tests can be employed in cases where the mammogram data needs supplementary testing. The ultrasound imaging may distinguish between a solid mass or a fluid-filled cyst. American medical bodies such as the American Cancer Society suggest an MRI in persons who have a higher risk genetically or who have a strong family background of breast cancer. Clinical breast examinations may also be done when the medical practitioners are conducting routine checkups. In the event that any suspicious results have been detected via the imaging or examination, a biopsy is usually conducted. This process is where tissue samples are taken from the breast to identify the presence of cancer cells. The national screening recommendations are focused on the diagnosis of breast cancer earlier so that it can enhance the survival rates. U.S. Preventative Service Task Force advises women in their midlife period and beyond to undergo regular mammography primarily after every 2 years, regardless of the age or risk factor. According to the American Cancer Society, women aged 45 to 55 years should be subjected to annual mammography with the possibility of providing the same screening at an earlier age. The American College College of Obstetrics and Gynecologists also give guidelines that support the regular mammography that should start around age 40, when in many cases, women may need regular mammographies. The screening advice can be different according to the environmental factors associated with a particular individual, such as a family history or genetic disposition. To identify the optimal screening period, providers assess the history of the patient and their risk. These national guidelines assist in early detection of breast cancer, which in effect enhances treatment results and minimizes death rates. Diagnostic testing of breast cancer entails the assessment of the accuracy and the estimated risks of the screening tests. The sensitivity and specificity of mammography are rather high, but the outcomes can be different in cases of differences in the density of breast tissue. The thick tissue of the breast may restrict the visibility of the tumor on the images, resulting in the need to perform another test of the images, including an ultrasound or an MRI. It may be a false positive result and cause additional diagnostics, such as a change in the biopsy. Although such cases can lead to temporary anxiety, they will help ensure that questionable discoveries are critically assessed. The confirmation of cancer diagnosis is based on biopsies that make it possible to conduct microscopic analysis of samples of tissue. Although the screening has some small risks, like exposure to radiation or emotional stress, the advantages of screening far surpasses all possible determinants, since early diagnosis has a major impact on survival and success of treatment. The preventative measures in breast cancer are geared towards alleviating the risk factors and encouraging healthier lifestyles. Eating healthier and living healthier can assist immensely in lowering the chances of breast cancer, since preventing the body to be in a poor condition is done through diet and exercise. Exercise normalizes hormone levels and it enhances the immunity, which in turn aids in the prevention of cancer. One should also limit alcohol consumption, since the incidence of breast cancer has been directly linked to alcohol consumption. The preventative measures of tobacco consumption and environmental exposures are also beneficial to long-term health and disease prevention. Healthcare professionals are to motivate patients to adapt healthy habits and notify them about the recommended screening procedures. Mammography and frequent visits to the doctor are also necessary elements of prevention, since they can help identify cancer at its early stage. There are proactive measures that people can take to limit the chances of breast cancer development by means of education, lifestyle change, and frequent screening. There are many organizations that provide funds to help in prevention, screening, and treatment of breast cancer patients. The Prevention of Disease Surveillance, Centers of Disease Control and Prevention make available those national programs that provide the screening of underserved groups. American Cancer Society has educational contents, patient navigation, and services that cancer patients can access. Coordination of prevention activities, community education, and screenings are other important roles played by public health departments. Mammograms can be offered cheaply or even free of charge via outreach programs already provided by local clinics and hospitals. Moreover, emotional support and guidance are offered by support groups and nonprofit organizations to help those who have experienced the diagnosis or treatments. These organizations are used to address the disparity in healthcare provisions through education, finances, and counseling services. By using these resources, screening would be much more likely to occur and people would properly obtain care and support. These questions on physical examination would aid in supporting essential ideas associated with breast cancer prevention, screening, and early detection. The initial question will require the learners to name the screening test with the greatest success in identifying early stages of breast cancer. The appropriate reply is mammography, which is currently the most popular imaging technique in the screening of breast cancer. The second question is dedicated to identifying the organization that developed evidence-based recommendations on screening. According to the U.S. Preventative Service Task Force, there are national guidelines that are used to assist healthcare professionals in making decisions regarding the timing and frequency at which people should undergo preventative strategies. The last question highlights the importance of early detection in enhancing the survival. Early detection of breast cancer enables individuals to have timely treatment, and chances of resulting positively and actual death rates related to cancers are decreased.